Hey guys, it's Audrey here with my daughter, Victoria.
You guys call me Sissy, though.
I call you Sissy. Who just turned 6? She did, this girl.
And she was already 6.
I was already 6 once in my life. Okay, so I wanted to do a recap on her hemangioma.
And this is Audrey, if you don't know her name.
And this is Victoria, again, just in case you don't know who she is. So, Victoria was born with a hemangioma, and ever since Victoria was born, I have been chronicling and documenting our journey to help other moms and dads out there.
I cracked my hemangioma.
I know you did once. So, I know you did. So,
and you did it on purpose.
I did not do it on purpose. Victoria was walking in our driveway, and I opened the car door, and the car door hit her, which I didn't see you, flush on the hemangioma, and started bleeding. So, and due to the delicate nature of the hemangioma,
had to go to the hospital, but no stitches.
Yeah, they couldn't stitch it because of the actually how delicate hemangiomas are. So, what we've been doing is chronicling it throughout her entire life, just so everybody knows, just so you have a gauge as to what hers looked like and what it looks like now. When she was born with one, it was all new territory for us. I knew one other family that actually had a daughter with a hemangioma, and they were very helpful to me.
It's my dad's friend.
It's your dad's friend, yes. And they were great at sharing photos with me and everything, but I wanted to do this on the blog.
And their daughter has a girl.
Yes, they have a girl who had it, their daughter. So let me show you really quickly.
Right here.
It was right there on her. So this is Victoria's hemangioma right there. You can see that it's this area of her skin is a little bit of a different patch than the other area. Victoria's hemangioma was, I would say, I mean, trying to gauge it here, it was a little bit bigger than a $50. It's changed size as she's gotten older, but it is, when she was born, it was extremely red. And I wanted to just answer some questions that people have asked us throughout the years. The one thing, I will say this, because I don't know if Victoria's going to want to sit through this whole video, but Victoria, does it hurt you at all?
I thought you meant my loose tooth.
No, not your loose tooth.
No, my other loose
your other loose tooth. Does your hemangioma hurt you at all?
No.
No. Have you ever, do you feel
only
it?
Only when I squeeze it.
Right, only when, I mean, if I squeeze your little arms, it would hurt. When I brush your hair, does it hurt? Does your hemangioma hurt? No?
Not that much.
Do you remember having a hemangioma when you were a little girl?
Yeah, I have a picture.
Right, you see yourself in pictures, right?
Can I show them?
Yeah, if you want to go find a picture, you can definitely show them.
No, Mom, there's one in our kitchen.
Oh, there's one in our kitchen. She's going to go get it. So how do hemangiomas start? That's really one of the most common questions, and I actually have a bunch of notes that I've written down just so I can answer properly, but this is my short answer. So a hemangioma are clusters of extra blood vessels right on your child's skin. Usually they appear, Victoria's appeared about pretty quickly. I remember the doctors knowing that something was wrong. They had looked at a discoloration on her skin. They actually thought it was a bruise at first. So, but it can obviously show up either right away or a little bit longer, like a couple weeks to a month after the baby's born. So it says here, there may be there when the baby's born or form within a few weeks or even months after birth. Some look like here we go. You did. This is Victoria's first birthday. So there you go. You can see right there. Actually, it has started to fade quite a bit. If you go back and watch some of our old videos of Victoria, you'll see that it was extremely red. It actually looked like
Was I loud in them?
Were you loud of them? A little bit. It looks like she had a little red egg kind of sticking off of her face. So that's what the hemangioma looked like when she was little. Another question we get is, what causes them? Why do you get them?
And we still have this hat.
We still have that hat.
Because we had it in my old house.
Yes, so you're going to have it forever.
This is our new house.
When I looked up this question, because I was originally told that maternal age played a factor, and also that they're more prevalent in girls than they are boys. So believe me, I did every kind of research you could when Victoria was born. But the answer that I found online was that hemangiomas that are benign, which are the ones that we're talking about, truly are the most common. That 1 to 10% of infants get them. Hemangiomas. I've been asked, are they genetic? And I really couldn't find a true answer to it. I will say my son William had a small hemangioma on his belly when he was born, but it went away by his, truly, I feel like by his first year visit, it went away. So some go away super quick, some don't, as in Victoria's case. What does a hemangioma look like when it's going away? And this is why I love being able to have created all these videos, because
that's why she does one of these every year.
that's why I do them every year, because I really want you guys to get a good gauge of what it looks like and what it has looked like from year to year to year to year. I've done tons of blog posts, so you genuinely could go to my blog and say, this is what a hemangioma looks at 2 years old, at 3 years old, at 4 years old in our journey. So they genuinely start to fade away. So the blood red started to obviously to go away, that color. It started to get almost like a grayish, and then now, as you can tell, it's pretty much now almost just like the color of her skin. It's a little gray. There is a little bit of a discoloration there, but you really do have to know it's there. You wouldn't see Victoria out and be like, oh my gosh, that whole area right there is a completely different color than around her face. You also could tell that it also is a little bit more, I want to say almost like squishy skin. There's like almost like a wrinkle to it. And that's because Victoria specifically, hers ulcerated when she was 6 months old. So we were treated for that. Now I blogged about all of that as well, and I also did a video on that as well, if that happens to a baby that you know, or to your own child. It did ulcerate, and everything was fine. It was very scary. But again, this is why I documented it, so you know, and you know what we did and how we got through it. Another question, when should I worry about a hemangioma? So I was worried the second I found out she had one, I think as most moms and dads would be. The one thing that now, as a quote-unquote seasoned mom who has gone through hemangiomas, you should really worry and have a sense of what should I do if the hemangioma happens to be really impacting a truly like a vital organ, okay? So we're talking if it's impacting like their hearing, their sight, their eyes, if it's growing in their mouths, if it's growing, like in a certain area on their body that is truly preventing them from doing ordinary things. I remember a doctor was telling us that, like, Victoria's, the one thing it's affecting, quite being very honest, is her vanity. But she was so little, she didn't know. He's like, it's a mark on her that someone's going to ask, what is that? But he said, I don't look at her and go, okay, so she's not going to be able to see. She's not going to be able to hear. She's not going to be able to smell. She's not going to be able to, like, actually use her mouth or her throat. Those are when people really start to, there's worrisome. And also when they're maybe growing on your liver, or obviously those are much different than what I'm talking about for Victoria. But again, many times initially it really does kind of come down to where is it located on your body. But I'm being honest with you, as every parent knows, you're going to worry because it's your child, and you're going to worry, and you're going to get answers, and you're going to want a doctor, and that's normal and very good. How long does it take for them to go away? So I have had, actually when I looked this up, this is the first time I had seen this answer, but there is usually for the first year of their life a sudden growth. I mean, I remember someone saying to me, do not panic. It's going to grow quick, it's going to grow big, and it's going to grow very red. And it did. All three grew very quick, very big, and very red. And that was just kind of what I needed to make sure I was prepared for. Usually when it hits a year mark, you know that there's not going to be truly additional, at least shocking growth after that first year. That's what all of the doctors told us. Now, I was initially told that what it looked like by the time Victoria was around 5 years old would really be where it would settle. The information that I just researched last night was over 1 to 10 years, it will still start to regress. So truly, I will keep updating every year. I definitely think there's a difference between 5 and 6, and maybe there's going to be a difference between 6, 7, and all the way to 10. But again, I'll update as we go along. What is the best treatment for hemangioma? So our treatment, which we decided for Victoria, was to do nothing. We watched it. We had to put, oh my goodness, what was the name of that cream? It wasn't Eucerin. Aquaphor. We put Aquaphor on her hemangioma because we were worried about the ulcerations. We needed to make sure that we kept it truly as lathered in Aquaphor as we possibly could, and we wrapped it in gauze. We did that for about, I think, like 2 months of her life when it started to ulcerate. We didn't do anything, and that was our decision, also our doctors at Boston Children's Hospital. You can put your child on a beta blocker drug. We opted not to do that for Victoria. We felt we just didn't want to do that. We knew that it wasn't impacting anything that she necessarily needed, other than that it was a mark on her face. But, that is an option. What? I will live. Yes, I will lift the chair up. The chair is on her blanket. So the beta blocker drugs, this is what I wanted to tell you guys, is that it starts to change the color of it, and it also helps it start to not only fade away, but shrink in size. That is why people most of the time will go on this beta blocker drug. The reason that we opted not to do it is because some of the side effects, high blood pressure, high blood sugar, and potentially wheezing. And again, we decided that because it wasn't hitting an area on her body where we were so worried about it shrinking quick. We knew that we would wait it out, the 5 to 6 years. So that was our decision, and I've talked about that also on some of the videos. It's a personal decision. There is no right or wrong answer. It really has to come from your situation and how you feel and how it is on your child. Can a hemangioma be removed? You can remove them through laser or surgery as they get older. Also, other medications do help with the removal process. Again, the beta blocker drug. But we have been told by our doctor at Boston Children's that Victoria is a candidate for laser treatment, plastic surgery, if she genuinely wants to get it removed. We don't know what we're going to do. You know, she doesn't want to remove it. It's a piece of... She likes it. See, you get that from the horse's mouth. She likes it. Right now, it's not bothering her. We'll cross that bridge the older she gets. But as of right now, that is not on our horizon to do anything about it in terms of removal. The last question that I always get is, can hemangiomas stay small? And quite honestly, most of them do stay small. I remember hers started, and I wish I had true measurements, but hers started about this big on her head. Now, she was truly an infant, 6 pounds, 10 ounces, so a tiny little circle like this looked mammoth on her head. As she got older, it did get bigger because she was small, and it obviously was growing. But I would say easily it was about, again, a $half size, a little bit bigger. Hers actually looked like almost like it was like a long oval. It wasn't like a perfect circle, and it really genuinely stayed like that. Usually once you hit 1 year, again, like I said before, the size it is the size that it stays. So just know that peace of mind. The other piece of it too, I just wanted to share with anybody out there. Ask questions, drop me an email. My email is right on all of my information, and I'll make sure it's in the description as well. I'm here. I'm an open book.
And I'm under the table.
And she's under the table as we do this. I'm an open book. I genuinely feel that this was something that really took a year of my life in terms of worry and doing a lot of research and doing a lot of questions. Everything I found online was super scary, and I remember my doctor finally at Boston Children's Hospital telling me, stay off of Google, stay off of WebMD. This is why you have me. And I remember thinking at that point, she was about 3 months old at the time, you know what, he's right. I'm going to just document my own story. Every case is potentially different, and every case isn't super scary. But everything I was finding online was super duper scary. So I just want to share our story. I always update at 6 years. I mean, every year at 6 years old. This is Victoria. This is her now. Come on up here one more time so everybody can see your beautiful face, girlfriend. Come here. We have a bathing suit on because her birthday is July. Okay, ready?
Well, we already passed.
Come down here. Ready? And then stay right there. There's her hemangioma. Wait, let me close the screen. Boom, right there. You can see, right? You can see it a little bit. I love it. It's my favorite part of who she is.
And this is me.
Oh, this is her too. There we go.
And my name's on
her name's on the back. So thank you guys so much for watching. Appreciate your support, and always for you guys listening.
And you can see a little
bit of the hemangioma. And you know, it was all.
And this is at my old school.
Yeah, and it's also been great too, educating her brothers, her friends, our family on hemangiomas. And quite honestly,
and I don't know. Those are not any of my loose tooth.
No, they are not.
See?
They are not. Yeah. Okay. We're going to wrap this video up. This isn't about
my
teeth.
grown-up tooth is right here.
There we go.
And
it's
then that's my loose tooth.
That's her loose tooth.
See?
Yep, we see. Can you say over and out?
Over and out.
Bye, guys.
Peace out.
Peace out.